Hi, you're tuning in to Migraine International Patients Perspective. And instead of going back to the Migraine Buddy app today, like I promised last week, a topic has come up that I decided to take on because of a discussion in one of the groups. And the topic is about neurologists and their attitudes towards patients. The question that was asked in one of the groups is, what do you think about a neurologist accusing of patients of not wanting to be cured? And it brings up a larger topic about choosing your neurologist or your doctor. Who are we seeing about our migraines? Now, many of our general practitioners want to take on the task of managing our migraines. Now, I did that back in the 80s and 90s. I had a general practitioner that was managing my migraines before I knew anything about neurologists. And then I found a neurologist that wasn't very good at it. And then I've been through several different neurologists. And the more I learned about neurology and different doctors and their methods of, treating migraines, my wife kept asking questions, since she was not a neurologist. She's like, when are they going to fix this? And why are they keep throwing medicine at you? So what I discovered over decades of dealing with this is that neurology and migraines is sort of a trial and error. There's really no cure for migraines, and neurologists are basically taking their cues from first your different tests, your MRIs, to find out what's wrong, what's physically they're able to see from the MRIs in your brain, the indicators of the age of your brain, whether or not you've had TIAs or bleeds or meningiomas or things like that in your brain that can indicate tumors or pressure or things like that. They use those things as indicators of what could be causing pain. But the rest of it, they pretty much have to go by blood tests for blood sugar, blood pressure, and then what you tell them. The rest of the information they get from you. So you have to be thorough in what information you give them. So when things like Migraine Buddy, the app, came on the scene, it gave us as migraine sufferers a tool to better organize our thoughts as to what our triggers are, where we have the starting and ending of our pain, what our pain levels are, and it helped us organize our information. So as far as the doctors go, you do have some doctors that are stubborn, that are arrogant. I had a doctor at one of the best hospitals in Detroit that he wouldn't listen to what I had to say. He, there were medicines, for example, topramate. He started me at the highest dosage. It caused numbness in my lips and tongue. It caused tingling in my fingers. It caused this part of my face to feel numb, and you also get that dumb, what do you call it, that effect that you really lose your ability to function because your memory goes to crap. And my wife was like I was a zombie at the time, and I wanted him to take me off of it or put me on something else, and he was arrogant enough to say that he knew what he was doing and I didn't. So it was like him ignoring me. So yeah, you have to be able to make the decision that this person isn't working, and ultimately make the choice to find someone else. Now, I know if you live in different countries other than the United States, sometimes choices are more limited. and you may not have easy access to neurology or neurologist. Now, the neurologist that I'm going to now, what is the great thing about her is she herself is a migraine sufferer. Now, if you can find a neurologist that's also a migraine sufferer, obviously that person is going to have more, just like the groups that we enter in, on Facebook and other platforms, they're going to identify more with what you're going through. So if you can find someone like that sympathizes with what you're going through because they also go through the chronic pain of migraines, they're going to be able to manage and identify with what you're going through and be a little more sympathetic towards your plight. So let's see. Treat migraines, as you explained, frustrated. I'm looking at some of the comments on this thread. They talked about migraine, chronic depression, not responding to meds. So my suggestion is if you are a chronic migraine sufferer, you can actually do initial appointments with a neurologist, and instead of subjecting the entire appointment to them questioning you, you can question them in the appointment. If they get frustrated with you, that's fine. But you want to know about them and their philosophy of treating migraines. So, look up their history on the internet if you can find them. Find some things that they've written about their migraine treatment, what their philosophy is about treating migraines. Do your research. And don't be afraid to shut the doctor down if they start rambling on and get your questions asked. Okay? If you are timid and you're not able to do that, take someone with you, your spouse, your boyfriend, girlfriend, mom, dad, whatever, and discuss this kind of stuff with them before you go and what it is you want to find out from the doctor, and make sure either you or the person you take with you gets the answer to those questions. Now, you don't have to be rude about it, but you do have to be insistent enough that you get those answers. Okay? I hesitate to say forceful, but sometimes you just have to shut them down in the conversation enough to where you can get your questions answered. Now, sometimes you do have to listen to them. That's why you go to them, because they are the professionals. Like I said in the beginning, neurology is not an exact science. It's not likely you can look at an x-ray or a brain and figure out exactly what's going on. The best definition I have heard about migraines is that a migraine is an overactivity of the nerves in your brain, an oversensitivity. Okay, so when the outside stimuli, whether it be caffeine, sunlight, smells, whatever the stimuli is that is aggravating your brain, our brains act like an electronic net that when those stimuli get there, it overactivates, and that overactivity is read by our brains as pain. Okay, and that may not change. There may not be any way to change that. So the best way to explain that is the neurologists are trying to find out what those triggers are and help us eliminate as many of them as possible. And by using preventatives, maybe prevent those triggers. And in the meantime, find out ways to prevent the pain in the first place using preventatives like the CGRP preventatives like Aimovig, Ajovy, Emgality. Some people use Botox, and now they have CGRP pain relievers. So there's different things that come out from time to time. That's why they use what do you call them? Seizure medicines. That's the same thing. The neural net, or whatever you want to call it, goes into seizures, and that's read by our brains as pain. So they've used the seizure medicines as preventatives as well. So as time goes on, they find different ways to do those things. So back to the original thing, and I'm going to wrap this up, is when you consider who your doctors are, if you're not getting what you need from the doctor you're with, before you blow your doctor off, look and study and try to find someone that is a headache specialist. Your general practitioner is not. They may pretend to be, but they're not a headache specialist. Okay, so look for a headache clinic, a neurology clinic, one of those people that might be, a specialist in migraines. So if you're in an area that's limited, maybe you can do it virtually with telemed. And good luck to you out there. I hope this helps you get a little bit of a mindset of, these doctors that are serious about helping you with your migraines. They're going to do it because they have a passion for it. If you've got someone that is not passionate about helping you with your migraines, look somewhere else, because migraine pain is a serious business and it needs to be treated seriously. If you're not getting that treatment, look elsewhere. My name's Stephen Lyford with Migraine International Patient's Perspective. This is episode 11, and thank you for listening.